Hello everyone, my name is Huanghe Zhang. I'm a medical student from Taipei Medical University. I'm very happy to have this opportunity to present my study. The topic I'm going to present is the basilar artery on computed tomography angiography score, also called BAMS score, for predicting functional outcomes in vertebrobasilar artery occlusion, a meta-analysis. I'm going to start with introducing vertebrobasilar artery occlusion, and then talk about the method we use, and finally what result we found. The vertebral and basilar arteries serve as the main vessels for blood flow through the posterior circulation, and occlusions of the posterior circulation arteries account for about 20% of all strokes. The vertebral basilar artery occlusion may cause significant neurological deficits, as known as posterior circulation cerebral vascular syndromes, including visual loss, sensory and motor abnormalities, ataxia, bulbar, and oculomotor symptoms. Intravenous thrombolysis and endovascular thrombectomy are the main treatment for vertebral basilar artery occlusion. In general, the modified rating scale, MRS, is used for measuring functional outcome following ischemic stroke. In our study, we also use MRS for assessing the functional outcome after ischemic stroke. Patients with MRS of 0 to 2 and 3 to 6 on day 90 were classified into the favorable and unfavorable functional outcome groups respectively. The BAMS score is a CTA-based 10-point score which assesses the thrombus burden and extent of collaterals. Figure 1 shows the vertebral basilar artery system. As long as the arteries are patent, we can get its corresponding score. In our study, we aim to perform a systematic investigation and meta-analysis to evaluate the prognosis value of BAMS score in functional outcome in vertebral basilar artery occlusion. Figure 2 shows the process we screen articles. The keywords we used when screening articles were stroke and BAMS score. And finally, 6 articles were selected for use. In Figure 3, our results show the favorable functional outcome with significantly higher BAMS score compared to the unfavorable functional outcome group, with standardized mean difference of Cohen's d 0.96, 95% confidence interval 0.59 to 1.32, p lesser than 0.001. The findings supported that the BAMS score could be valuable for discriminating the favorable functional outcome in patients with posterior circulation acute ischemic stroke. This is the end of my report, and thank you for your attention.